Good morning to all. Today's class is Cranial Nerve 1, that is olfactory nerve. Okay. So what are the specific learning objective? Origin, course, gross anatomy of first cranial nerve. What is related applied anatomy? First introduction. There are 12 pair of cranial nerves. Out of that, first 2 pairs arise from forebrain. Next 10 pairs arise from brainstem. So they are numbered from 1 to 12 in craniocaudal sequence of their attachment. Fine. Now, so origin of cranial nerves, first 2, that means olfactory is the number 1. Number 2, that is second cranial nerve is optic. They both arise from forebrain. Now from 3rd to 12, all arise from the hindbrain. Okay. Out of that, here actually the term should be brainstem. So brainstem includes midbrain, pons and medulla. Okay. So the 3rd and 4th, that is oculomotor and trochlear, arise from midbrain. Then 5th one trigeminal, 6th one abducent, 7th one facial, 8th one vestibulocochlear. They arise from pons. Then 9th glossopharyngeal, 10th vagus, 11th accessory and 12th hypoglossal. They arise from medulla. Okay. So remember, there are 12 cranial nerves. Out of that, first 2 arise from forebrain, remaining 10 arise from brainstem. Brainstem consists of midbrain, pons and medulla. Out of that, 3rd and 4th arise from midbrain, 5, 6, 7 and 8th arise from pons, and 9th, 10th, 11th and 12th arise from medulla. Now, what are the functional components? So whenever we talk about any cranial nerve, there can be motor fibers, that is motor component, then sensory fibers, sensory component, or there can be both motor and sensory fibers. Okay. So what are the types of motor fibers? Motor fibers, that means they will be supplying the muscles. Okay. So there are 3 motor fibers. One is general somatic efferent. Remember, whenever it is efferent, that means motor. If it would have been afferent, that means sensory. Now, general somatic. Okay, so general somatic efferent fibers, that means they supply the striated muscle which develop from somite. Second one is spatial visceral efferent. Okay, so they are also supplying the muscles. They are supplying the muscles which develop from mesoderm of pharyngeal arches. And third one is general visceral efferent. Okay, remember all are efferent. Out of that, one is somatic efferent and 2 are visceral efferent. Out of that, the 2 are general efferent and 1 is spatial efferent. Okay, so remember, general somatic efferent is to the striated muscle which are originating from somites. Spatial visceral efferent, that means the muscle which are arising from the mesoderm of pharyngeal arches. And general visceral efferent means which are supplying the glands, smooth muscle of viscera, blood vessels. These are preganglionic parasympathetic fibers. Okay. Now, what are the sensory fibers of cranial nerve? Sensory fibers means, remember, everywhere there will be afferent. So, general somatic afferent, general visceral afferent, spatial visceral afferent, and spatial somatic afferent. Okay. So, general somatic afferent means carry general sensation of pain, temperature, and general sensation of pain, touch, and temperature from the skin, or proprioceptive sensation of vibration and muscle and joint sense. Okay. Now, general visceral afferent, that means they carry the general sensation of distension and ischemic pain from viscera. Okay. Ischemic pain from viscera. Then spatial visceral afferent means they carry spatial sensation of taste from tongue. Then spatial somatic afferent means spatial sensation of smell, hearing or balance. So whenever we talk about any cranial nerve, okay, they will have certain functional component. They can have either motor component, or they can have somatic component, or they can have either motor and somatic. Okay, see, all cranial nerve will be carrying some either they are carrying the motor fibers, or they are carrying the sensory fibers, or they are carrying both. Okay, so whatever cranial nerve we are talking about, definitely there will be some functional component. Okay, now olfactory nerve. So olfactory nerve is first cranial nerve, it is pure sensory. So when it is purely sensory, it will be having sensory fibers. That means it will be having afferent fibers. Okay. Now it is carrying the sense of smell. Okay. So it is carrying the sense of smell. Now you see here. So when it is purely sensory, it will not have these motor fibers. That means no general somatic efferent. It will not have special visceral efferent. It will not have general visceral efferent. But it is carrying the sensory fibers. That means it will have some afferent fibers. So what afferent fiber it will have? It will not have. Now olfactory nerve does not carry these sensation, pain, touch or temperature. So no general somatic afferent. Then it is not carrying sensation of distension. So it is no general visceral afferent. Also it is olfactory nerve is not associated with taste sensation. So no spatial visceral afferent. So the only one functional component is there for olfactory nerve, and that is spatial somatic afferent, that is spatial sensation of smell it is carrying. Okay, so that is olfactory nerve. So what is the unique feature of olfactory nerve? The primary sensory neurons lie on body surface in epithelial lining of nasal cavity, and their dendrites lie free in mucus film, and primary sensory neuron undergo continuous turnover. They are continuously replaced by stem cells in olfactory neuroepithelium. So that is the unique feature of olfactory nerve. Olfactory nerve is the only cranial nerve whose primary sensory neurons are exposed outside. Okay, no any cranial nerves primary sensory neurons will be exposed like this. Okay, now so as I told you, what is the functional component? Only one functional component. Since it is sensory, so it is afferent. Okay, then it is carrying the spatial sensation, so it is spatial somatic afferent. Okay, so it is carrying a spatial sensation of smell from olfactory region of nasal cavity, and it is terminating in olfactory bulb. Now what is the course? So course, relation and distribution. The primary receptor neurons, which are modified bipolar neurons of olfactory epithelium of nasal cavity. Okay, so within the olfactory epithelium of nasal cavity, these primary receptor neurons will be there, which are modified bipolar neurons. Okay, now these around 20 minute bundles of non-myelinated nerve fibers, they will form a nerve, that is olfactory nerve, which will pass through the foramina in cribriform plate of ethmoid bone to enter anterior cranial fossa. In the anterior cranial fossa, they will terminate in olfactory bulb, and they will synapse with mitral cells. Okay, now this olfactory bulb will continue posteriorly as olfactory tract. This olfactory tract will divide into medial and lateral olfactory stria. Now remember, the fibers from lateral olfactory stria will go to primary olfactory cortex, and here from primary olfactory cortex it will reach to entorhinal cortex, which is known as secondary olfactory cortex. So this is the reason where they will be ultimately going. Okay, so now here you can see the diagram. Here these are the bipolar neurons. They are forming olfactory nerve, which is crossing or which is piercing the cribriform plate of ethmoid bone. From here they are reaching to olfactory bulb. This olfactory bulb is continuing as olfactory tract. You can see here the olfactory tract. This olfactory tract is divided into lateral and medial olfactory stria. You can see here the olfactory receptor cells within the olfactory bulb. Then this is the olfactory tract. Then this is the olfactory stria. This olfactory stria, lateral and medial one. The lateral one will be going into primary olfactory cortex, and from primary olfactory cortex it will be going to entorhinal cortex or secondary olfactory cortex. Okay, so that is the course and relation of olfactory. Now you can see again, you can see within the olfactory epithelium there will be primary receptor neuron. They will be piercing the cribriform plate of ethmoid bone after forming the olfactory nerve. They will be terminating in olfactory bulb. They will be synapsing with the mitral cell, and then olfactory bulb will continue as olfactory tract, which will be divided into medial and lateral olfactory stria. And Here the fibers from lateral olfactory stria will go to primary olfactory cortex, which ultimately will reach the entorhinal cortex. You can see again the same thing here. This is the olfactory tract, lateral olfactory stria, medial olfactory stria. This is the olfactory bulb. This is the diagram of olfactory bulb, where you can see the mitral cells anastomosing with the olfactory neuron, and here is the primary olfactory cortex and entorhinal cortex. Fine. Now you can see this diagram. Here is the cribriform plate of ethmoid bone. This is the olfactory mucosa, where the bipolar neurons will be there, which will be piercing this, and here they will be entering. That is the anterior cranial fossa. Okay, so here these are the small nerve fibers which are going from the olfactory region to the olfactory bulb, and this is the olfactory tract, and this is the olfactory stria, which diagram you are seeing. Okay, here you can see this is the olfactory tract, and here is the lateral olfactory stria, this is the medial olfactory stria, and here is the primary olfactory cortex and secondary olfactory cortex. So here, remember, the primary olfactory cortex send nerve fibers to many other centers in brain to establish connection for emotional and autonomic response. Okay, so that is one of the applied anatomy. Second one is anosmia, when there is a loss of smell sensation. When it occurs in the anterior cranial fossa injury. So loss of olfaction is normal process with the aging. Okay, now these are few terms which you should remember. What is anosmia? There is no sense of smell. What is hyposomnia? That means it is a decreased sense of smell. Hyperosmia means increased or overly acute sense of smell. Dysosmia means impairment or defect in sense of smell. Then parosmia means perversion or distortion of smell. Then phantosmia means perception of an odor that is not real, that is not existing. Then presbyosmia means decrease in the smell due to aging. Okay, this is not any disease but due to aging. And cacosmia means inappropriate, disagreeable odor. Coprosmia means fecal scent, and olfactory agnosia means inability to identify or interpret detected odors. That means you are not able to identify what you are able to smell. Okay, so that is the olfactory agnosia. Fine. So thank you. Okay, that is the class.